All right, Dr. Cynthia Snider from Cone Health is with us taking your questions. This is, of course, about the kids and the vaccines and the booster. What is the latest on all of that?
So right now, just I believe it was last week, or maybe last 10 days, children from the ages to 5 to 11 have been approved for their booster shot. And then also, I believe the manufacturing companies have also submitted their application to the FDA for kids under 5. And so what it looks like is that probably similar to adults, 3 shots may be like the magic number to really keeping a sustained higher level of efficacy for the vaccine series. So I think again, if it's been over 5 months since they've had their series, this is also a good time to getting them boosted, especially since they'll might be going away from camp or having more sleepovers at other people's homes, and especially as the rates go high, this may be a great time for them to get boosted.
This next question is, I'm recovering from COVID now, so when should I get my booster?
That tends to be, in the beginning, we used to let people wait. Like, we thought that it would be a good time to just wait 3 months, but now it is really actually safe to get the booster as soon as you feel recovered from your illness.
As soon as you feel recovered. All right.
So it could be at the end of your isolation. So
right.
If it's been 2 weeks and you feel fine, it's a good time to get your booster.
Full isolation for those weeks, and then when you feel better. Speaking of that, what about people who have long COVID? This person's asking, how long can they expect their symptoms to last?
I think we don't really have a good sense of how long people are having symptoms that still cause like fatigue, and also like intermittent fevers, still having joint pain. Some people have had recovery. I think I remember reading a study that said about a third of people felt like some recovery between that 6 to 9 months. But I think we still just don't know enough about the disease process to know exactly like how everybody gets better and what to do. I would recommend for folks who feel like they have long COVID to discuss that with their primary care doctor, and also consider being referred to a clinic that can evaluate you and see, just to ensure that there's no other disease process that's contributing to your symptoms.
And do we have a clinic that is like that here for people with long COVID, so that if they need a specialist kind of look?
Yeah, I would say I'm aware that a lot of the different health systems have created like at least a clinic or some process where they look into that.
Okay. All right, this next question is, should I still be masking up on the flights I'm taking?
Yes, I'm a big fan of masking on public transit. And I would say that especially on flights that are longer, even before we had a understanding of like how this spreads so quickly, we know that there has been easy transmission on planes. And even though I know that they've increased like HEPA filtration, it's pretty easy to wear a mask. Obviously you can take your snack and then put your mask back on. But I think to make your trip enjoyable and making sure you don't get COVID going or coming, it's pretty easy to wear your mask throughout the flight.
All right, this next question is, can I return to work if my symptoms are gone, but I'm still testing positive after 10 days?
I would check with the policy at your workplace, because I believe that, I think depending on what your job is, they might ask you to stay back and extend your isolation. But if you're not having symptoms, that's actually really reassuring. And usually the 10-day isolation should be sufficient.
Okay. And this question is, if you never finished your initial vaccine series, do you start over, or can you just get the second shot?
That is an excellent question, because I think we've had a lot of people who did one shot, felt horrible, didn't want to do it, may have gotten COVID and then kind of forgot about it. I mean, I think it really depends on the timing. I don't think there's a downside to restarting the vaccine series. There's more information to really promote the mRNA vaccines, such as Pfizer and Moderna, and less so the J&J vaccine for now. So I would say go back out there and get your vaccine started again.
Okay, thank you so much for your time. We so appreciate it. And if you missed any of this information, you can find it in the To Your Wellbeing section of our website. Just go to WFMYnews2.com.